Myalgic encephalomyelitis ME, also known as chronic fatigue syndrome CFS, is a complex and debilitating illness characterized by profound fatigue and a range of other symptoms that significantly impair daily functioning. The condition is often marked by persistent, severe fatigue that is not relieved by rest and is exacerbated by physical or mental activity. Key features of ME/CFS: persistent fatigue, severe and prolonged fatigue that does not improve with rest and often worsens with physical or mental exertion. Post-exertional malaise PM, a worsening of symptoms following physical or mental activity that can last for days or weeks. Sleep disturbances, unrefreshing sleep, insomnia, or other sleep-related issues. Cognitive impairment, problems with memory, concentration, and processing information, often referred to as brain fog. Symptoms of ME/CFS can vary widely, but common ones include fatigue, persistent, debilitating fatigue that affects the ability to perform normal daily activities. Post-exertional malaise, a worsening of symptoms following physical or mental exertion, which can be severe and prolonged. Sleep disturbances, problems such as unrefreshing sleep, difficulty falling or staying asleep, or disrupted sleep patterns. Cognitive impairment, issues with memory, concentration, and mental clarity. Muscle and joint pain, unexplained muscle pain, joint pain, and stiffness. Headaches, frequent and severe headaches. Orthostatic intolerance, symptoms such as dizziness, lightheadedness, or fainting upon standing or sitting up. Sore throat and swollen lymph nodes, frequent sore throat and tender lymph nodes without an apparent infection. Causes and risk factors. The exact cause of ME/CFS is unknown, but several factors may contribute. Infections. Some individuals report that ME/CFS began after a viral or bacterial infection, suggesting an infectious trigger. Immune system abnormalities. Dysfunction of the immune system or an abnormal immune response may play a role. Genetics. Genetic predispositions may increase susceptibility to ME/CFS. Stress. Physical or emotional stress may trigger or exacerbate symptoms. Environmental factors. Exposure to certain environmental factors or toxins might be associated with the onset of ME/CFS. Diagnosis. There is no specific test for ME/CFS, and diagnosis is primarily based on clinical criteria. Clinical evaluation, assessment of symptoms and medical history. The diagnosis is often made by ruling out other conditions that can cause similar symptoms. Diagnostic criteria. Criteria such as those outlined by the Institute of Medicine (IOM) or the Canadian Consensus criteria may be used to diagnose ME/CFS. These criteria typically include persistent fatigue lasting more than 6 months, post-exertional malaise, unrefreshing sleep, cognitive impairment or orthostatic intolerance, exclusion of other conditions. Tests and evaluations to rule out other conditions that could explain the symptoms, such as thyroid disorders, sleep disorders, or psychiatric conditions. Treatment. There is no cure for ME/CFS, and treatment focuses on managing symptoms and improving quality of life. Symptom management. Pain relief, over-the-counter pain medications or prescription drugs for managing muscle and joint pain. Sleep aids, medications or behavioral strategies to improve sleep quality. Cognitive behavioral therapies (CBT) may help some individuals manage symptoms and improve coping strategies. Rated exercise therapy. Get a controversial approach involving gradual increases in physical activity. Some patients report benefits, while others find it exacerbates symptoms. It is essential to approach exercise cautiously and tailor it to individual needs. Lifestyle adjustments. Pacing, balancing activity and rest to avoid overexertion. Developing a plan to manage energy levels and avoid PM. Diet and nutrition. A balanced diet that supports overall health and energy levels. Stress management. Techniques such as mindfulness, relaxation exercises, or counseling to manage stress and emotional well-being. Supportive care. Occupational therapy, to assist with daily activities and adapt to physical limitations. Physical therapy, to improve physical function and manage symptoms, tailored to individual capabilities. Prognosis. The prognosis for ME/CFS varies among individuals. Some people may experience gradual improvement, while others may have a chronic or fluctuating course of illness. The severity of symptoms can range from mild to disabling, and the impact on daily life can be significant. Challenges and considerations. Misunderstanding and stigma. ME/CFS is often misunderstood, and individuals may face skepticism or stigma regarding their condition. Multidisciplinary approach. A holistic approach involving healthcare professionals from various disciplines may be necessary to address the multifaceted nature of ME/CFS. Conclusion. ME/CFS is a complex and challenging condition with no known cure. Management focuses on relieving symptoms, improving quality of life, and supporting individuals in coping with the impact of the illness. Ongoing research aims to better understand the condition and develop more effective treatments. If you have specific questions about ME/CFS or need more information on managing the condition, feel free to ask.